Chronic kidney disease and acute kidney injury have both been associated with adverse short-term outcomes after MI. We are here to talk about the association of in-hospital acute kidney injury with long-term outcome in survivors of acute myocardial infarction and some insight from the NCDR. To do that, I'm with Dr. Purav Mody, MD, who is a fellow at the UT Southwestern Medical Center in Dallas. Now, we have a variety of papers, I think 19, that are being presented from the NCDR here. Why did you decide to do this one?
Why did I? This stems from the fact that I have had an interest in outcomes research, and looking at the NCDR registries, the action registry, which is a very big, rich clinical source, I was looking at something which I thought would be an interesting analysis to do, which would also help in terms of, day-to-day practicability, like how we can apply that research and hopefully guide more future research decisions. So looking at the literature, there's not much on acute kidney injury events in hospital, and I think the ACTION database had some really good variables that allowed us to look at it, and hence we decided to go with the NCDR registry.
And certainly it is something that does happen. So what did you find when you opened up the data book and decided to look at this?
So unsurprisingly, we found that acute kidney injuries are fairly common. In our analysis, we found that at least 7% of the patients admitted with an MI or an ACS event tended to have an AKI event, and given 7% over millions of patients is a large number. And the main thing that we found is even minimal elevations in creatinine were associated with worse outcomes. And so for us as clinicians, it was just like a moment where we paused and took a step back, saying, hey, even a small bump in creatinine is something that needs to be looked into.
Now, in terms of how is it that these injuries are occurring?
Great point. So these patients are fairly sick to begin with, and there's a whole spectrum of these patients who present with ACS. One extreme would be patients who are actually in shock, and that can lead to bad kidney function. We tried to kind of tease out that part and make our analysis as clean as possible. So we tended to exclude patients who had a very obvious reason to have a kidney injury, like came in with cardiogenic shock or were supposed to go for surgery. And so we limited our population to patients who on a routine basis should not be getting these injuries. The other reason why you could have kidney injuries are the fact that certain medicines that we use, we use a commonly used medicine is an ACE inhibitor, which tends to drop your blood pressure, and in some cases there could be decreased perfusion to the kidneys and you could have a kidney injury. Sometimes it's from the contrast that you get from getting an intervention in the cath lab, and that itself could lead to what we call contrast-induced nephropathy. So there are multiple factors that come into play which can predispose an individual for developing a kidney injury.
Is it something that we can reduce the rate of those kidney injuries? Now that we know that they can be connected to bad outcomes, can we make some changes that will help reduce this rate?
So that's a great point. I would just kind of urge a little caution there in the sense that in our analysis is an observational analysis. So while we see there's an association, it's not causal. So yes, having an AKI event leads to worse outcomes. What I guess the more important message could also be that this is just an indirect marker of a patient who's sicker on multiple levels. Maybe he has a higher atherosclerotic burden, or just for reasons unknown to us as yet, he is just somebody who's a lot sicker, and hence he's doing worse. So given, I guess, based the observational nature of our analysis, it's tough for us to just say that, hey, if you remove AKI, you will improve outcomes. I guess that's where future research would be interesting. That's where personally I would be looking at, is seeing if we actually try minimizing it, does it impact outcomes or not?
Well, thank you very much, because we have, like I said, a variety of NCDR papers being presented here, and we are summarizing them in both CardioSource World News and CardioSource World News Interventions. Please look for those in print and here online, where I'm Rick McGuire, Executive Editor.